Steve Hanley from the Upper Township Beach Patrol, and today I'm going to be talking to you about the principles of assessment. This could be one of the most important chapters for lifeguards to learn about. Our primary job will be to assess whatever victim we are dealing with as we are awaiting the EMT to come and take over and provide more advanced care. So we'll be talking about the differences between illness and injury, the differences between signs and symptoms, and what to do during an assessment, including the primary and the secondary assessments. Here are the objectives. We're going to differentiate between the mechanism of injury and the nature of illness, differentiate between a sign and a symptom, and describe the components of an appropriate assessment and the purpose of each. Okay, we're also going to be describing the methods used to measure and quantify an ill or injured person's mental status. We'll use a couple of acronyms, and one will be the sample history tool to understand the history of the patient we're dealing with. I will describe the components of the other acronym, which will be BP-DOC assessment tool. We'll state the characteristics that are obtained when measuring and assessing respirations, pulse, and skin signs. So we'll talk about how to measure those things. Describe the purpose and elements of the reassessment as we're waiting for that EMT to get there. And finally, to discuss the importance of what documentation that we should have when caring for an ill or injured person. All the people you respond to care for could be categorized as either being ill or injured. The nature of the illness refers to the general cause of the complaint. Examples could be difficulty breathing, chest pain, or dizziness. Mechanism of injury is a term used to describe the general cause of the person's injuries. Examples could be being hit by a wave, collision with a surfboard, a fall from the height, or a twisted ankle. Sometimes it's easy to identify people who are seriously ill or injured, but sometimes it may be more difficult to tell how injured or ill a person is. When arriving at the side of an ill or injured person, you will ask yourself, is this a problem that warrants calling for backup, or is it something less serious? The judgment that you rely on is called, of the ill or injured person, is called the general impression. It is simply how the person appears to you. Now we'll pause for some discussion in our Ed puzzle. As you perform your assessment of the person, you'll be looking for anything that may be wrong and listening to what the person complains of and describes to you. A sign is something that you can actually see. That's important to remember. Examples could be bleeding, an obviously broken bone, or swelling. A symptom is something that you cannot see, but the person tells you. Examples of this could be pain, nausea, or dizziness. You'll want to gather as much information from the ill or injured person as possible. This is done by performing a hands-on assessment and asking specific questions to the persons. These tasks make up the first assessment. Now let's take a quick check. What is used to describe the general cause of a person's injury? And what is used to describe the general cause of a person's illness? A good assessment must be performed in a logical and consistent manner in order to ensure that nothing is missed. For this reason, the assessment is broken down into different components. The scene size up is to identify any immediate or potential hazards at the scene, as well as the need for additional resources. The scene size up is broken down into these following components seen here. First of all, safety. This would include typical hazards you'd see in real life, such as traffic, but in our case, incoming tide, rough sea, location of jetties, etc. It also would need to identify the need for personal protection, such as gloves or other protections. You want to also look at the nature of illness and the mechanism of injury that you're dealing with and determine whether this is an illness or if it's some kind of injured. Determine the number of ill or injured and do your best to identify how many people are involved in the situation and relay that to the people who you're calling for backup. And then again, look at additional resources you might need, equipment you might need, organizations that might need to be called. You also want to make an immediate assessment if you think that there is a possible back or neck injury so that you can determine whether you need to stabilize that victim immediately. Foremost, we want to make sure that the patient that we're dealing with is not in any immediate life-threatening circumstances. So the first things we want to check are the mental status, the airway, breathing, and circulation of that patient. Okay, these would definitely be an immediate life threatening situation. So we're going to talk about each one of these, starting with mental status. A person's mental status refers to their level of responsiveness and awareness of their surroundings and the situation. You should begin introducing yourself and see how the person responds. You would expect to see a responsive person look at you and respond verbally. If the person is awake, you must determine if they are alert or are they confused. A person who is aware of who he is, where he is, and the time is generally less urgent than someone who isn't. If a person is disoriented in any way, this is evidence of a more serious underlying problem. In these cases, you or someone else must call for the EMT, 911, and backup. An unresponsive person who appears to be unconscious and is not able to respond to your presence or questions. In these cases, you must rely on the information from the scene and the bystanders for clues about what is going on. There's a scale you can use when describing a person's mental status, and this would begin with A, meaning alert. This person's awake and talking. V means verbal. This means that the person only responds when spoken to. P, pain. This is when a person will only respond when a painful stimulus is performed, such as a sternum rub, which be used to perform the stimulus. A sternum rub is when you firmly rub the knuckles of one of your hands up and down their sternum. And U, unresponsive, this is when a person does not respond at all. As you're awaiting backup, mental status is something that you should be reassessing throughout this time while you're waiting for other personnel, including your EMT, to get to the scene. As we've already discussed, without an adequate supply of oxygen, we would all die rather quickly. One way to ensure that an ill or injured person gets adequate oxygen is to ensure that their airway is open and clear. If you're not sure that the person is adequately moving air in and out of their lungs, you will need to manually open the airway by performing either the jaw thrust or a head lift chin tilt maneuver that's been discussed in our CPR classes. Remember that an open airway is only half the equation regarding adequate oxygen for the ill or injured. A person must be moving an adequate amount of air in and out of the lungs. In most cases, a person who is awake will be breathing normally, but that is not always the situation. Once you've ensured an open airway, you must carefully look, listen, and feel for adequate breathing. If you feel the person is not breathing adequately, you must provide rescue breaths. Be aware that gasps do not always indicate adequate breathing and should be carefully calculated to see if that breathing needs to be assisted. Circulation status refers to two things. First, is the flow of blood throughout the body, and is the heart beating? The other is determining if there's any obvious uncontrolled bleeding. In most cases, if the person is not breathing, you will need to perform CPR. Check the pulse by either checking the carotid pulse, as you see in this photograph here, or with a conscious person, it may be more convenient to check radial pulse alongside their wrist. Question: should you perform a primary assessment before or after the scene size up? So, the secondary assessment. Once we've determined that there are no absolutely immediate life threatening situation, but the victim or patient is in need of help, um, it is important to note that the secondary assessment, again, consists of two components. And we're going to be looking at the patient history and a physical exam of the patient. So the history includes as much information about the current problem and the chief complaint and any past medical history that may pertain to this current situation that we're dealing with. And this is where we're going to come across our first of these acronyms that we're going to learn about. The first acronym is SAMPLE. So we're going to remember SAMPLE. All right. S stands for the signs and symptoms. Okay. Remember signs are things that you can see, and symptoms are the things that the victim can feel. So you ask, where does it hurt? How does it feel? Next is allergies. A, allergies. Do you have any known allergies? The medics are going to want to know that when they arrive. M, are they on medications? Any prescription or non prescription medications that they may have taken? P, their past medical history. Do they have any existing conditions? And has this typical or this current situation happened before? L, their last oral intake. When's the last time that you had anything to eat or drink, including alcoholic beverages at that point? And then E, events leading up to this call. What was going on when this incident occurred? Did you do something that caused this to happen? So that is the sample and acronym that you should know when taking that first step into the secondary assessment. So before I ask this question in the quick checkup here, I want to point out on the last slide, if you're dealing with children, they may not be able to answer all those questions from the sample history. You may have to rely on relatives or parents to give you the answers. And obviously, if the person is of altered alert status or even unresponsive, you would have to get that information from the bystanders. But for the quick check question, here's what it is. In what part of the sample history might you learn that the person you're caring for had a heart attack 6 months ago? Okay, now going into the next acronym, we'll be talking about the BP doc. Okay, and there are two general approaches to performing a physical assessment. The approach that you'll take will be determined by the level of responsiveness of the ill or injured person. Generally, a responsive person will be able to tell you what's wrong with them. Your assessment for a responsive person will be focused on their chief complaint. An unresponsive person cannot tell you what they are feeling. You must rely on what you see during the physical exam and information you gather from bystanders. It is important to always protect yourself from during this whole process from being exposed to blood or any other bodily fluids of the ill and injured person. So you want to make sure you're using those gloves and any protective barriers that might be available. So to perform the physical examination, use the BP Doc tool to help you remember what to look for. B stands for blood. Inspect the body for any bleeding. P stands for pain. Ask the person if they have any pain and where it is. You will be able to palpate for other areas that they are painful as you perform a physical exam. D, deformities. Observe for deformities of any kind, such as angulated limbs or bumps or swelling. O, open wounds. Observe for any open wounds. And C, probably a new term for you, but it's crepitus. And crepitus is a peculiar crackling or grating feeling or sound under the skin or in the joints. Recognizing this is especially important when examining an unresponsive person, as they cannot tell you when something hurts. If crepitus is felt, you can assume that there's an underlying bone or joint injury. Yeah, for this next segment, I want to preface this by saying that this is all part of the advanced first aid course. But as lifeguards, we would expect that we have an EMT and higher level medical personnel on our way. So this next component would only be something that we would apply if the EMT, for whatever reason, indicates that they are delayed or if backup medics are not going to be on scene anytime soon. So we're going to begin talking about how to do a physical exam of a ill or injured patient. And during this physical exam, you will palpate the entire body using a gloved hand. You do this firmly, but not so firm that you cause the person any unnecessary discomfort. And as you're doing this, you will visually examine each area, looking for anything abnormal using the BP Docs tool. So, starting with the head and neck. Number one, if you suspect an injury to the head or neck, have another responder, lifeguard, hold the person's head still. And if you are alone, tell the person if they are able to be conscious to keep their head and neck still as you continue. Chest. Injuries to the chest can cause serious internal bleeding as well as breathing difficulty. Carefully monitor the breathing status for all those with chest injuries. Abdomen. Pain in the abdomen could be a symptom of internal bleeding and or injury. Pelvis and hips. This is another area that can have serious internal bleeding. Legs and feet. It may be necessary to remove clothing to expose the legs and feet so the injuries can be seen. Ask the person to move their feet and feel their feet as you touch them. Arms and hands. Again, you may have to remove clothing to see their arms. Ask the patient to move their hands and fingers. Also, if they can feel you touching their fingers. Back. Assess the back if you have reason to believe there is serious uncontrolled bleeding. If you must move the person, ask others for assistance supporting the head and neck as you log roll the person into position. Quick check. Is the assessment different or the same for an unresponsive person compared to a responsive patient? So before we start talking about vital signs, I just want to remind that as lifeguards, we generally have EMT backup. We have ambulance squads or paramedics that would be responding. So that last slide where we actually physically palpate the body would generally not be done by the lifeguard. Lifeguards should be familiar with trying and during the secondary assessment to take some vital signs and understand what these vital signs mean. So we're going to explain these as well. And vital signs are an important part of your assessment. Common vital signs that can be obtained and monitored without special equipment include pulse, respirations, and signs with their skin. So the pulse. A pulse is what you feel when the heart is pumping a wave of blood through the arteries of the body. It can be felt with the fingers when a pulse point lies close to the skin and over a hard surface such as a bone. Two of the most common pulse points are the carotid pulse point on the neck and the radial pulse point along the wrist. The carotid pulse point, this is found at the front of the neck, immediately adjacent to the trachea, which is the preferred location to check the pulse of an unresponsive person. A radial pulse point, this is found at the wrist, located on the anterior side of the wrist, just proximal to the thumb. This is the preferred location to check the pulse of a responsive person. When you're assessing the pulse, you will note the pulse rate, strength, and rhythm. Okay, the rate, a normal pulse rate for an adult would be between 60 to 100 beats per minute. To assess that rate, you want to palpate the pulse and count the number of beats you feel in 15 seconds. Then multiply that number by 4 to get an accurate minute rate. You want to analyze the strength of the pulse and determine whether the pulse is strong or weak. And rhythm is where you assess whether the pulse is either a regular or irregular rhythm. So when you're assessing the respirations of a person, you'll determine the rate, depth, and ease of breathing. The normal respiratory rate is between 10 to 16 breaths per minute. To assess this, you will count the number of respirations in 15 seconds and then multiply by 4 to get an idea of how many respirations you're getting per minute. After determining the rate, you'll want to observe the depth of each breath. A person with an adequate depth of breathing is said to have a good tidal volume, or GTV. You also assess the ease of breathing and make a determination whether it's difficult or easy for that person to breathe. So now let's talk about the skin signs. All right, skin signs are assessed by looking at the person and can be accomplished in a matter of seconds. You want to assess the person's skin color, temperature, and moisture. So for color, a normal finding for light-skinned people would be described as pink, warm, and dry. When assessing dark-skinned individuals, look at the inside of the lower lip or the nail beds for color. These areas will be pink with normal skin signs. For temperature, this can be affected by the environment and exertion, so take the time to factor these things into consideration. To assess for temperature, take the back of your hand and feel the forehead for the temperature. It will either be hot, warm, or cool to the touch. And then finally, moisture. This is also affected by the environment or exertion, so you want to make sure you factor that in. But normal skin is usually dry. Moist skin is not typically normal for a person at rest and may be signs of stress on the body. So, as you're waiting for your EMT and medics to arrive, understand that the assessment process for the ill or injured person is never complete. You will reassess the person for as long as they are with you. A proper reassessment should be performed at regular intervals. It is recommended that a reassessment take place every 5 to 15 minutes, depending on the condition of the person. A proper reassessment of the person should include the following: recheck the primary assessment, airway, breathing, and circulation. Once again, ask them about the chief complaint, the signs and symptoms, and see if they appear to be getting worse or are they remaining the same. Check their vital signs again. And also use interventions which refer to the care that you or document the interventions that you've done, which refers to the care that you provided that person. So now we're going to talk about documentation. Okay, so as you're with this patient, it's important that you have a documentation of what you've done for the assessment. And if you can't document this, you have your partner or someone stand by, document as much as this you can while maintaining adequate care for the patient. All right, the kind of things that you want from your patient would be their name, their age, their chief complaint, the signs and symptoms that have been observed, their vital signs that you've recorded, the medical history that you've been able to ascertain. Make sure you have any interventions, any care that you provided, and also how in its entirety you have responded. So now a quick check. Why is documentation important to the process of caring for a person who is ill or injured? So that's the key components of an assessment of a patient, both the primary and secondary assessment. I'm going to review some of the key terms, and then there's going to be some review questions here to make sure you understand the knowledge you need from this unit. Okay, so let's start with the chief complaint. That's the one thing that is causing the ill or injured person pain or discomfort, and the reason help was called for. Crepitus. Most of us probably did not know what that was, and that's a peculiar crackling or grating feeling or sound under the skin or joints. General impression, important to know for the assessment. A quick assessment of the seriousness of the situation performed upon arrival at the scene. Immediate life threat. Any condition that is immediately harmful to the ill or injured person, such as the blocked airway, inadequate breathing, or uncontrolled bleeding. Mechanism of injury refers to the general cause for a person's injury. Nature of illness refers to the general cause of the person's complaint, such as difficulty breathing, chest pain, or dizziness. And a primary assessment is the first step in the actual assessment of the ill or injured person, where you determine life-threatening conditions. A reassessment is a recheck of the ABCs, the chief complaint, vital signs, and interventions that have taken place up until that time. Scene size up is an overview of the scene to identify any immediate or potential hazards at the scene of the emergency, as well as the need for additional resources. A secondary assessment is a thorough examination of the ill or injured person, beginning with the chief complaint and including the evaluation of the vital signs. A sign is something that can be seen or measured, such as bleeding, swelling, or how fast a person is breathing. And a symptom is something that cannot be seen but the ill or injured person feels, can describe, such as pain or nausea. And vital signs are the key signs of life, which include respirations, pulse, skin signs, and blood pressure. And now for some questions. All the following are examples of symptoms, except which of the following describes the nature of illness? Specific care that you provide to an ill or injured person is called an The pulse point found on the anterior neck near the windpipe is also called the blank pulse point.
Perform a visual head-to-toe assessment of the injured person. If the person is conscious, give them your name and let them know you are there to assist until emergency responders arrive. Ask them what is hurting and what happened. If you are not alone, ask another person to activate the emergency response system by dialing 911 or EMS while you check the injured person. If you are alone, you may have to leave the victim to summon help after you have assessed the person's injuries. If you are certain that an injured person has no life-threatening conditions, you should perform an injury assessment known as a secondary survey, which is a systematic method of gathering additional information about injuries or conditions that may need care. An important point to remember is that if life-threatening conditions exist, such as unconsciousness, no breathing, no pulse, or severe bleeding, the victim needs the immediate care of a certified first aid or CPR provider to provide basic life support and stabilize any conditions until professional medical help arrives. The secondary survey injury assessment process has two basic steps. The first step is to interview the victim and bystanders. If the victim is conscious and can speak, learn whether he or she has any signs or symptoms that would indicate a condition that could become life-threatening. Find out what happened, what is wrong, or what hurts. The second step is to perform a head-to-toe examination to look for injuries. Be sure to tell the victim what you are doing and why. Do not aggravate injuries, contaminate wounds, or move the victim if you suspect a neck or spinal injury. Begin at the head and check the scalp for bleeding or deformities such as a goose egg. Check the ears and nose for any clear fluid or bloody discharge. Check the mouth for blood or foreign materials. Notice whether the eye pupils are constricted or dilated. Cover and uncover the eyes to see whether the pupils react. Look for unequal pupils because a difference in size almost always indicates a medical emergency. Check the chest and abdomen for cuts, bruises, penetrations, and embedded objects. Check the arms and legs by feeling and looking for injury, deformity, and/or tenderness. A good tip is to compare one side of the body to the other. Finally, for a potential spinal injury, check sensations and strength in the extremities by pressing the victim's foot against your hand and having him or her squeeze your hand. If a person is unresponsive and breathing normally, it may be reasonable to place him or her in a lateral or side-lying recovery position. This is acceptable if you do not suspect that the person has any pelvic or spinal injuries and if you must leave the area. Extend one of the person's arms above the head and roll the body to the side so that the person's head rests on the extended arm. Once the person is on their side, bend both legs to stabilize the body. 911 or EMS should be alerted as there are many different conditions that can cause someone to become unresponsive. Some conditions, such as fainting, may not require additional medical care, but a medical professional should make that determination. If they are unresponsive and not breathing normally and you know CPR, begin CPR until emergency responders arrive. Otherwise, an injured person should only be moved when you are faced with immediate danger, such as fire, lack of oxygen, risk of explosion, or a collapsing structure. Some people suffer from certain medical conditions. These people may wear a form of medical identification, usually a special bracelet, or, less commonly, a necklace. These are often Medic Alert bracelets, but other types are available. Be sure to look for such medical IDs, which will notify you of specific medical conditions. Do not remove a medical alert tag from an injured person for any reason.
You know, there are many ways to determine and assess the victim of an accident, illness, or injury. Hi, I'm Captain Joe Bruni. What I'm going to discuss and talk about is how to basically assess a person's vital signs without using any technical instruments like a blood pressure cuff and stethoscope or things along those lines. The first thing that we want to assess is their level of consciousness through the pupils. Ask them, do they know where they are? Do they know their name? And to see if they are alert and oriented. We can also take a light, shine it in the person's eyes to see if the pupils are equal and reactive, and are they symmetrical and of the same size. Level of consciousness. The next thing we would want to determine is pulse rate. We can gain the pulse rate or gauge the pulse rate by feeling the radial pulse in the wrist or the carotid pulse up in the neckline. Count the beats for 15 seconds, multiply by 4 for our heart rate. We would then move on to respiratory rate and count the respiratory rate watching rising chest fall or stomach rise and fall for 15 seconds, multiplying by 4. Checking skin condition by examining whether they're pink and flushed or pale and sweaty, cool and clammy, which would be a poor indicator. And then finally, checking capillary refill or circulation by taking a pen or some type of hard object like our fingernail, pressing down on the nail bed and watching the white spot turn back to pink in the time it takes to say the words capillary refill. That nail bed should have flushed back pink again. All a good vital sign. Basic steps in determining vital signs without using any type of instruments or measuring equipment. I'm Captain Joe Bruni. Stay safe, and we'll see you next time.
If they're unconscious or unresponsive, but breathing normally, put them on their side in the recovery position. This helps them to continue breathing normally by keeping their airway open and clear. For example, it stops the most common airway obstruction, their tongue, from falling back and blocking the movement of air. It also means that any vomit or fluid which comes back up can come out, rather than causing them to choke, which could happen if they're on their back.
To put your casualty into the recovery position, this is what to do. Kneel beside the casualty and get yourself in a comfortable position. Check the casualty's pockets and remove any bulky items. Remove any sharp rings, and if they're wearing glasses, take them off. Make sure that both the casualty's legs are straight. Place their arm nearest to you out at a right angle to their body, with the elbow bent and the palm facing upwards. Their arm can be placed straight out to the side if it can't be placed at a right angle. Take their other arm and place it across their chest, and hold the back of their hand against their cheek nearest you. With your other hand, lift their far leg just above the knee. Pull it up until their foot is flat on the floor. Now you're ready to roll them onto their side. Keeping the casualty's hand pressed against their cheek, carefully pull on their bent knee to roll the casualty toward you onto their side. Now their top arm should be supporting their head and their bent leg should be on the floor to stop them from rolling over. Their top leg should be at a right angle to their body. Remove your hand from under theirs. Check the casualty's head is tilted back. This will keep their airway open and clear.
Once the casualty is in the recovery position, you should call for medical assistance if this hasn't already been done. Remember to recheck the casualty's breathing at regular intervals until medical help arrives. If it stops, you'll need to give them CPR. If the casualty has to be kept in the recovery position for more than 30 minutes, turn them onto their opposite side to relieve the pressure on their lower arm, unless their injuries prevent this.